Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guests today are Adnan Masood, chief AI architect at UST, and Anand Nair, he's head of healthcare payer at UST. Welcome, guys.
Thank you for having us.
Thank you, John. Looking forward to it.
Yeah, excited for this discussion. Before we dive into today's topic, how about you tell us a little bit about yourself and UST? Maybe you can start, Anand.
UST was founded in 1999 and born digital. We are a purpose-driven organization helping our clients to do technology-led transformation. And we currently operate out of 20 countries and 38,000 people. Our largest vertical is healthcare, and we are working with our customers to improve the health and well-being of the members they serve. Through our healthcare customer, we touch roughly 150 million lives in the US. And I have been working in UST healthcare practice from day one of its inception and have lived through the entire growth journey and evolution of UST healthcare practice over the last 23 years. I'm currently leading UST's healthcare practice, and I'm very passionate about leveraging technology to make healthcare equitable and empowering everyone to lead a healthy and quality life. Adnan, I will pass it on to you.
Thank you, Anand. Glad to be here. My name is Adnan Masood. I run the AI and machine learning group at UST. I'm a machine learning PhD and I've been working with UST for a while now. I'm also a Microsoft Regional Director, which kind of gives me it's an honorary title where I work with Microsoft and their ecosystem for artificial intelligence. I was also visiting a scholar at Stanford University. So working with retail, healthcare, and finance, these three major verticals which UST works in, I lead a team of developers. We build solutions with modern algorithms in AI and machine learning. We have been working with generative AI before. It was cool. And it has been a really exciting journey to take these modern approaches of artificial intelligence, which is now becoming like a household name, and implementing them to bring efficiency and care and better care standards to the healthcare. And this has been an amazing journey, and I'm glad to be here and talking to you about it.
Yeah, well, let's dive into that because you're right. AI is cool now. So let's see what, but there are some challenges. There's some interesting, it's moving quickly, right? So Adnan, maybe you could start with us. What do you see happening with AI when it comes to things like rules and regulations?
Yeah, that's a very interesting topic. So I'll do a quick introduction to AI regulations and rules, and I'm hoping I'm not giving you a lot of editing work to do. So I'll try to.
Oh, you're good. We like the details.
So in this case, for example, when you're talking about this, as there's a shameless plug, I actually wrote a book with my co-author on the exact topic called Responsible AI for the Enterprise. I think it's blurring out, but you can probably put in the show notes. And essentially, we talk about the responsible AI implementation, because artificial intelligence, like other disciplines, is very much prone to, because we use it for decision management system, we use this for a lot of sensitive things, and that's why AI regulations are quite important for to be considered when it comes to implementing AI in sensitive areas, in highly critical areas. For instance, it can have bias. For instance, it can have toxicity. It can become, racist in a second. So those things are really important for AI. So there is a huge amount of different type of regulations being put in place, not just from AI perspective, but also from a data security and privacy perspective. So, for instance, if you look at NIST, the recent framework came out from NIST. It's National Institute of Standards and Technology. You might have heard of, right? And they came up with a framework called AI Risk Management Framework, and that essentially it's a voluntary guide. By the way, all of these standards I'm going to talk about are voluntary. There haven't been any measures which are put in governance like GDPR or a PCI compliance or a HIPAA compliance. Like, these standards are enforced, but so far all the AI and machine learning standards are all voluntary or self-dictated by companies themselves. So now that I guess we have established why it is really important to have AI regulations, the main one, NIST is one of the, I guess, most important ones that just came out. They call it Risk Management Framework, or RMF, and I see that evolving for building safe, secure, explainable, privacy enhanced, fair, accountable AI solutions, right? These are the things we really need. Then we have FDA's regulations for AI and healthcare. Those are more like device clinical support tools, device centric, not necessarily algorithmic centric. And you're seeing right now, it's becoming much more of a model marketplace, more about GPT-3s and GPT-4s and Geminis of the world, right? So what we need is more of that regulation, and that's where we are falling short on, and that's where I think the NIST framework would be able to help. So those are some of the, I guess, key regulations or guidelines, but there are also potential future regulations in play. If you look globally, though, like Europe has the EU AI Act, and Europe is moving fast in setting requirements for the high-risk systems. They are emphasizing like documentation for training data, risk mitigation, external audits. And I think this is really important because these models hallucinate. They have confabulation. They make up stuff, right? They don't really, the factuality of these is not there unless you actually implement these guardrails around it. So implementing those guardrails is a really, really critical part of that. Other global examples, for example, Japan, China, Brazil, UAE, all of these have AI regulations in place. Singapore was one of the first countries who have actually built AI regulations. So it's a fairly diverse landscape right now when it comes to regulations, but there are no healthcare specific regulations for data privacy, efficiency of medical interventions, patient safety and efficacy when it comes to AI tools. Diagnostic and treatments are in place, and they are in works, and I'm hoping to see them soon.
I mean, it's an interesting framework you put out there. And I just asked the question, like, do we really want all these regulations? And maybe Europe will tell us, Singapore will tell us if they're successful or not. We'll learn from their early experience. But I say that from two perspectives. One is that AI is moving so fast and regulation moves slow. So can the regulations keep up with the innovation? That's problem one. And then the second problem I heard someone describe to me was that the problem with regulations is they often just create barriers to entry to startups and innovators, and secure the AI environment for the incumbents, which I thought was an interesting, and we've seen that in other industries. Yeah, we see it in EHR with certified EHR, right? What do you think? Do we really want regulations of AI, with some of these challenges?
That's a great question. I'll start on this, and then maybe Anand can add the healthcare perspective too. It's a great, it's a divisive topic. From AI perspective, our take is that when it comes to research and development, there should be no barriers in that capacity other than the regular barriers you have from because if you restrict that, like for instance, one of the restriction could be you can only make a model as large as maybe 500 billion parameters. Like that's kind of like a ridiculous limit you are going to put on research, because you can't limit that, especially when it comes to artificial intelligence, because you can only enforce it maybe within the US demographic, and you are letting other competitors get ahead. Secondary, that those limitations, it's not a stem cell research where you need a wet lab, you need all the instruments and everything associated with that. This is more of somebody has a computer and a powerful enough hardware, and they can actually experiment. So it's more democratized. So regulations in general for research and development not really is not a good idea, because you are restricting the innovation, the development, and things, and you are letting other nations or other actors be working on them. Where the regulations make sense is applications. So applicability of those where you want to regulate. So for example, in healthcare, when it comes to patient safety and efficacy, I don't want to have a decision support system which says John needs his leg amputated. And you're like, can you explain why? It's like, yeah, because the algorithm said so. It has no transparency. It has no explainability. It doesn't have any kind of information in there, or data leakage. data privacy and security, right? So HIPAA enforces the strict guidelines around patient data, but imagine a model getting trained and it leaks data about patients. Like that's you probably don't want that to happen. Transparency and accountability of these decision support system, and also making sure there's no bias in those applications. Again, the applications. So algorithmic applications, algorithms, we know they encapsulate our biases in. So recently, a very large healthcare payer is getting sued because what they did is they are sending people of color to a certain healthcare standard and practices, and they were sending other folks to a different healthcare standard practice. Now, you would say, this is racism, and we need to not do that. Of course, this is bad. So algorithms cannot encapsulate racism. So we should not do that. And now the only way you would understand this is the research should be open to understand these racist models, but the applications should monitor it. So I'll tell you something really interesting. I know I'm going a long-winded here, but one of the really interesting things is sometimes we think like, well, how about we remove the race from the patient profile? Well, okay, would that make it non-racist or non-sexist? That's not really true. The algorithms have the capability to infer it from other things. So you'll say, okay, fine, I'll take the name out because name might be inferring to that. You probably have heard about what happened with the large company who was stacking the resumes. If your gender is female, they were stacking it much lower. I mean, this is happening. And it's not like people are putting gender in the resume. It's because it will infer from the name. It will infer from your educational institution. It will infer from your sorority. Like it knows what kind of club you are in. So you're like, okay, fine, I'll take all that information out of this and I'll just put very medical terms. Guess what? MIT researcher we work with, her name is Marzieh Ghassemi. So by the way, I'm in charge of our relationship with Stanford and MIT. So I work very closely with all the researchers. Dr. Ghassemi recently published a report that by looking at an X-ray, right, it can tell your gender and your race. And it has no other information. So you see, these features are essentially a part of this. And that is why the applications need to be really look into these things, that they don't, they bring these cognitive biases and train them and make a systemic bias in there, and also have transparency and accountability in there. So yeah, we want regulations on applications, not on the research part of it. And it is going to move fast, and regulations will keep catching up. And that is why I think self-regulation is really important as well. Anand, you want to add something?
Yeah, I just want to touch on a couple of points, right? You talked about race and how important it is to capture those data as well. For example, pregnancy-related complications and child birth and mortality, right? It is high in certain races. So it's important to identify race in those scenarios so there can be proactive intervention to reduce those risks, right? To basically give them a better health outcomes. And again, right now, I see a lot of healthcare organizations hesitant to use AI. And when there is a regulation, they try to put a big safety net around the regulation to make sure they're not touching it, right? And that could possibly slow down. On the other hand, as you mentioned, Adnan, there are a couple of companies who are getting sued, the payers, a couple of payers and a handful of providers, right? And having appropriate regulation coupled with guardrails could possibly reduce that fear of getting sued as well, right? So we're looking through that lens. So I think we need to have the right amount of regulation. And John, to your point, they are catching up. I was reading an article that there were like 200 AI-related legislations that were put out, or bills that are in the works in 2023. That is kind of 4 or 5 folds what used to be last year. So that means that regulations are trying to catch up, and regulations are going to evolve along with how AI is going to be leveraged.
Yeah. Well, it is fascinating that you're right, that many things can be inferred. I don't think any of us on this, video have had a pap smear, and that obviously, indicates something. Whereas, anyway, there's a lot of inference that can happen from medical data that's pretty easy. Although it's interesting, when you talk about the equity ones, for example, African Americans versus Caucasians, and having race, ethnicity in those types of things, because in some ways, you could also argue that not having that data is discriminated in a different way, because now you're treating an African-American person the same as a Caucasian person, and yet their skin color and the diseases that present, et cetera, can be very different. And so we want that data so that it improves the care for the African-Americans and they're not getting treated like a Caucasian. Adnan, I imagine you've had that experience or seen this firsthand.
Absolutely. And I think this is an area where there's a lot of research being done. And this is a classical example. We talk about this feature called demographic parity and equalized odds. So these are some standards we follow when we're talking about this, the trustable, equitable AI. So what is equitable is not equal in the same sense. So for example, if you'll say that if you are representing a demographic in hiring, you don't want to discriminate based on race, color, gender, or any other traits. You only want to get merit is the most important thing in this case. But when it comes to, let's say, breast cancer analysis, do you think we should have 50-50 in that case? No, because it doesn't manifest itself in the same way for men versus it does for women. We don't see that happening in this case. So then the focus data would not be 50-50. We would not partition the data in a way that it would divide it by 50-50. Similarly, some of the diseases which manifest themselves differently, sickle cell anemia, for example, some of these diseases affect different population and different demographics differently. So you're absolutely right. We can't have that to say, we have to enforce some sort of algorithmic affirmative action there to ensure that, because we have to let data speak. Now, we have some standards, ethical standards and morals and our societal values, which we value and we cherish, and we want to have that in place. We can't have racism in hiring or in healthcare system or in other places. So this is why it is such a nuanced thing when the patient safety, data privacy breaches, bias in decision-making, the accountability, the explainability, those things come into play as part of the regulation.
Interesting. And the best solution I've heard is actually having these conversations. So I'm glad we're having them now, because that's the key to solving it, right? Is being aware that it's a risk and addressing it appropriately. Anand, healthcare is one of the most regulated industries, next to what, like nuclear power or something, right? Like, I think that's the only one that beats us, when it comes to regulation. So many healthcare people are like, I think we're regulated enough, right? Like, or how do you see it? Like, and when you talk to your customers, or is it maybe the fact that healthcare is highly regulated that illustrates why we need good AI regulations, because the risks are so high? How do you see it when you talk to your customers?
Yeah, you're right that healthcare is heavily regulated. At some point, I feel that the regulation keeps on adding, and benefits and everything will become so standard. The only differentiator is going to be customer service, right? That's what we keep discussing, and we can see that some of the payers are starting to invest a lot in improving the customer experience from that standpoint. And regarding the regulation, there are over 600 discrete regulations out there that the healthcare system needs to comply. And there are 4 different governing bodies that writes regulation. And sometimes both the payers and the providers say they don't get enough time to implement it. And an average hospital with around 150 beds, they spend around $8 million a year just for regulation. And in some organizations, they said a quarter, 25%, roughly 25% of the nurses and doctor times are spent on regulation-related activities, like taking the time away from care delivery. There is definitely significant opportunity exists to streamline it. Some of them may be really outdated, and we can also look at how AI can make managing those regulations easy, right? And that could be one use case that we can look at other than pure healthcare related. How can it ease the administrative effort? And another thing that I want to highlight is AI regulation is definitely going to evolve along with the adoption of AI, probably over the next several years. And as Adnan was mentioning, a proper use of AI is extremely important in healthcare. So we need to look at how we can change the mindset from leveraging AI to deny care to how do we leverage AI to deliver care, right? And how do we deliver it more effectively? How do we remove the barriers of providing healthcare, especially there are several locations or remote locations or rural areas in US where there is no primary care, right? How can we leverage technology and AI to give digital care delivery to those areas? So once we start changing that mindset from how payers are leveraging AI to deny care to how payers are leveraging AI to deliver care, I think there will be more acceptance, right, on this technology.
Definitely. I think I'll just quickly add to what Anand said a few things. As like the healthcare, the high level of regulation as healthcare it looks like a burden, but I think it's a testament to the sector's complexity and the critical importance of safeguarding patients' welfare, right? When it comes to AI, similarly, the rigor is needed. AI and healthcare, the similar rigor is necessary. And the rigor, I can't emphasize the importance of the rigor because the potential, like Anand said, in healthcare is huge, but the risks are big as well, right? So misdiagnosis, and if you're using an AI algorithms to do diagnosis, misdiagnosis due to biased algorithms or privacy breaches with sensitive patient data, right? These are huge concerns. So having effective AI regulations will ensure that these technologies can work and practiced in a safe and trustable manner rather than get compromised and patient care and safety doesn't get compromised. So just like healthcare, AI healthcare regulations I wouldn't consider that overbearing, but I think it's essential for responsible, effective innovation.
But I believe fixing the bias of AI probably is easier than fixing the bias of people, right?
That's an interesting question. Deep questions by Anand. But you're right. I mean, to some degree, and I think that's the other problem. Just like we want perfect AI, we're like, well, when were humans ever perfect, right? Whether it comes to bias, whether it comes to care, whatever it is, right? That's a really good point. Is it easier to improve the AI, which influences hundreds of patients, thousands of patients, or is it easier to influence thousands of providers that might have different biases?
Let's talk about an anecdote. I mean, it brings a point for a very interesting anecdote. Recently, you must have read about the story of how somebody applied for an Apple card, and the husband and wife had the same job, the similar level of education, the similar everything else, and the wife got a lower credit limit than the husband. It was all over the news. You can Google it. So why does this happen? Now, imagine if I'm a bigot and a racist and a really bad guy, society will check me, right? I will try to behave better in the environment where I think I'm going to get called out. And it will be harder for me to pass this nasty trait to the people. But when it comes to the system adjusts itself accordingly. But imagine an algorithm is racist and a bias like that, and it's constantly doing this on a large scale, and it's very invisible because you don't know everybody else's results. Like an algorithm starts not lending to the people of color or denying females or other people based on their identity lending decisions, right? So in that case, how would you measure that? And it's not overtly bigoted. So that's why maybe it is easier to fix people's biases or keep them in check than algorithms, because algorithm bias is so embedded in there. You must have heard of the research papers out there. Dr. James Zhao, I work with him very closely on various initiatives in Stanford University. He published one of the first papers called on language embeddings. It's called "Man is to Doctor and Woman is to." So if you ask any model, it says nurse. It converts that to that. Yeah, it's fascinating. If you ask, give me the names of the people who have the job of a doctor, an engineer, or a surgeon, you will get very mainstream Caucasian names. When you ask for recommend me names for a gardener, or what do you think this gardener's profession is, you will find Hispanic names. Like, these are the inherent biases. This is a big problem inherent in there. So we shouldn't take it lightly. it's a really significant issue when it comes to bias embedded in these algorithms. And they learn from Reddit, they learn from Twitter, they learn from media, they learn from all the text we have put on the internet. They're learning from our biases.
Yeah,
Yeah,
and
someone said it's not a
sometimes,
hallucination. Someone actually said it online and it's repeating it. What are you going to say, Anand?
yeah, sometimes it's a data that is used for training, right? So I don't know whether you have used the digital ID lanes in the airport security check, right? Then some of my friends were saying that it will not recognize certain race, right? Because probably it was not trained on certain data. So that is another additional thing. It's unintentional bias that's getting into the system by the way it is developed or trained. And we need to look at how we take a actual representative data, right? So that all possible scenarios are covered.
Yeah, I mean, let's look at value-based care. Everyone looks at it as a solution to the, so much of what plagues healthcare, which on its face makes sense. Let's treat them to actually improve the health of someone as opposed to just fee for service, right? On face value, it sounds good, but you throw that in an AI algorithm, what does that look like? It could spit out all sorts of discriminatory stuff that basically says, oh, all these expensive patients, let's not take them. Like that, humans understand why that's a problem, but the machine's going to say, oh wait, I'm optimizing for your value-based care. I'm going to bring you all the healthiest patients. And who knows, within ethnicity, gender, I mean, maybe all us men will be discriminated against because we aren't as healthy as the women. I don't know what the AI might say, but right, it could be inherent in those models. So it is worth a discussion.
Again, to value-based care that you mentioned, sometimes, again, the regulation or policies that are put in place can have unintentional outcome. So there was an increased effort to reduce hospital readmissions, right? And yes, that goal was achieved. And when somebody was looking at the ultimate health outcome, it was not that great. Some people who were genuinely need to be readmitted were not readmitted, right? Because people were working towards some metrics. So we need to look at eventually how it impacts the health outcomes and the quality of life, right? And that measure should come into everything.
Yeah, interesting. Well, Anand, it was interesting when you said that we should use AI to understand the complex scenario of regulations, which is actually, I don't know if I love or hate that idea because it is so complex. But talk to us about, what are you seeing as like some of the latest versions of generative AI that's being used in healthcare? Maybe you can start Anand and then Adnan.
Sure, I can start with that. Now that you touched about leveraging AI for administrative and regulatory effort, right? The healthcare cost, right now it's like 4.5 trillion, right? And it's expected to go up by 7% next year. And increase, apart from cost of care, inflation, etc., the increase is also attributed to healthcare workers experiencing burnout and subsequent workforce shortage, right? And I was reading one of the Forbes article, and they were suggesting that Gen AI technology has the potential to spare the U.S. healthcare medical sector at least 200 billion in annual expenses. And reduce burnout. And reducing burnout is, again, extremely important. And now we see that a lot of primary care physicians are quitting the primary care practice, which is basically supposed to be the quarterback of our healthcare system. Right now, there is around 5,000 primary care physician shortage, and it's expected to go up to 50,000 plus. And I believe that a generative AI can play a significant role in improving the productivity of the healthcare and care delivery people in actually giving care delivery and not work on administrative stuff, right? And again, generative AI will empower care coordinators and customer service agents, again, without having to worry about regulation and impact that Adnan was talking about, because healthcare is very sensitive. But there's a lot of opportunity exists to see how we can make the care coordinator more efficient by giving them a digital assistant, right, so that they can be more effective and reduce their administrative time? How can customer service agent be given something like a co-pilot so they can be more effective? So there is a lot of traction coming in that aspect, and also from the life sciences perspective, how can we accelerate the drug development? We know that a new drug development, including the failed trials, is extremely expensive. How can that can be made more efficient and also compress the timeline? And another thing that is most important, again, I want to touch on what Adnan talked about, to not to put too much regulation on research, is how generative AI can be leveraged to create synthetic medical records, right? That can be leveraged for R&D without having to worry about regulation or violating any HIPAA or privacy policies.
Yeah, these are some of the great points. Thank you, Anand. So a couple of things I'll add to that, John, as in synthetic medical records. So right now, we can't use, when you're doing software testing, the records from production. That's really obvious. But how do you create in-distribution records? Somebody who doesn't look like John Doe, but actually looks like John Lynn, who has his demographic, his BMI, his all the circumstances he would go through typically. So that is now possible through generative AI. Generative AI is really enabled, and LLMs and transformers are not, I mean, they have been coming a long way, and NLP researchers know that. But now that it looks like this new and shiny thing, so we just talk about it. But AI in general has enabled that. When we are talking about generative AI, there are two key things it does. Mostly people focus on the generation part of it, but there's also comprehension. So it can comprehend now, understanding large PDF documents and reports and customer longitudinal patient record is possible. So previously, if you are trying to understand a patient information, all you had is whatever is in the EHR system, whatever is typed in there. All the dark data of doctor's notes and the medical history, which is coming from like documents, handwritten notes. Even think about the imaging part of it. Like all of that was invisible. Now with multimodal models, you can create these, you can ingest all that information and create more meaningful data-driven, really data-driven insights, right? Personalized treatment plans, drug discovery and treatment, which Anand talked about. That's actually something which is not science fiction anymore. I recently saw a talk in Stanford. There was a graph neural network implementation of this, and they actually went through and they have done some really significant work. I'll send you the information about the researcher shortly. It's I'm blanking on you, but the drug discovery and development is going really well with Gen AI. Soon we'll see some significant insights into that. Medical imaging analysis, right? That's another use case I'm seeing right now being done with using generative AI, predicting the patient outcomes. That's another one of the use case I've seen implemented some of those as well. Enhancing the patient engagement through the health care assistant. That's a lowest hanging fruit. We are seeing that constantly. UST has built several of these solutions for different clients where health assistants now can integrate. But now the bar has risen. Now we don't want that boring chatbot. We want actual meaningful conversation. So, transforming the patient care, research, diagnostics, but overall efficiency gaining. I mean, these things we are constantly seeing, and the bar is constantly getting raised for using generative AI in the enterprise.
So interesting. And it's moving so quickly, right? And how it can be used. But I love how you framed it. There's the comprehension and the generation, which I think is the differentiator of what's happening right now. But here's what I'd ask you, and maybe Anand, you can start on this one. Do we really have an idea of what AI is going to look like through 2 to 3 years from now? Like, I mean, a year ago, a year and a half ago, we wouldn't have even had this conversation, right? So, what can you maybe easily predict is going to happen, or what are some things you're maybe uncertain about?
One thing I can say is AI can be an extremely powerful ally, especially looking from the healthcare perspective. But as Adnan said, but improper use can cause significant damage too, right? The healthcare organizations need to approach this technology with appropriate guardrails, along with human in the loop whenever it's applicable. And I strongly believe that GenAI is going to empower members and patients like ever before, right? And enabling them to be an equal partner along with the doctors and caregivers in choosing the right treatment options and right to treatment decisions for them, right, in the near future.
Well, the damage can be twofold. One is risk to patient safety or, even revenue, et cetera. But it could also be damaging them from wanting to use AI because it's not working effectively. Maybe it doesn't even cause a patient safety incident. We saw that with voice recognition, I think, when it rolled out. People used it and they're like, well, this isn't quite right. And so then they threw it out. And then, then it eventually did get to 98%. And they're like, well, I was burnt out. I'm not trying that. So there's risk multiple ways, right? If we don't
exactly. And regarding future, based on what I understand, Adnan, you can correct me or add more. So OpenAI is kind of doubling its power like every 6 months, right? And in couple of years, maybe five to 10 years, it will have over a trillion parameters it's going to look at and possibly surpass the number of connections we have in human brains, right? And I think that in the future, I don't think AI is going to replace doctors, nurses, caregivers, but I strongly believe the people who do not use AI or use AI for simulation, getting trained in medical, facilitating the medical training, etc. People who do not use AI will get displaced, right? And another thing that I believe is based on today's technology, social media companies can determine the personality of your spouse more accurately than you can, right? And why not use that power, right, to make healthcare accessible to everyone, including people in rural areas where there are no primary care within 50 miles or 100 miles, and also empower everyone, right, to have the right information at their fingertip, right, and help them lead a healthy and quality life, right, in a safe and responsible manner, of course.
And what would you add, Adnan?
Yeah, I mean, I would first ask for that spousal personality helpline number if they have at Facebook. I would like to know that. This is great. So, future is hard to predict because, of course, it's about the future. But I'm bullish on generative AI. I think there are groundbreaking changes we can expect in 2024 and beyond. I feel like ChatGPT's birthday, just happy birthday ChatGPT, it was a few days ago, right? And it has completely brought this to the zeitgeist of people's front and center mind. People are seeing the possibilities and what it can do. So 2024 is going to be definitely a very busy year. Like it has to, generative AI has to play a major role in reshaping the medical practices, enhancing the healthcare access to people, improving the operational efficiencies, and we'll see a lot more in that. So some of the key themes I would say would be AI as doctor's co-pilot. So a physician co-pilot. It's not, like I said, it's not replacing people, but it will transition as an assistant, from an assistant. Right now, it's like passive, to a virtual co-pilot in the healthcare with physicians, with nurse practitioners, which will analyze like these vast patient data. We talked about longitudinal patient record. So it can help you pinpoint diagnosis and craft these personalized treatment plans for you. And doctors will oversee that. And it definitely speed up diagnosis. They can focus on the bedside manners while it enhances their accuracy, has read all the New England Journal of Medicine, and provide that patient outcome more accurately. So the doctor's co-pilot will be the first theme we will see happening. The other theme I'm seeing, and that's not, and none of these are futuristic, we are already seeing some of this happening, is the role of unstructured data in patient care. So I worked on that problem. Anand has worked on this problem where you have this all unstructured data and doesn't become a part of your medical processes or payer processes. Now, these transformer-based model and with these modern NLP capabilities, we can use this unstructured data and it can become a cornerstone in the healthcare analysis, right? Whether it's EHR systems, whether it's the diagnostic system, they're all going to be able to look at the complex patient records and do the correlation for claims processing, for upcoding, and for virtually any of the healthcare efficiency and effectiveness processes, it will be highly useful. So these are the two key themes. Other themes I'm seeing is like, we talked about some things around like democratization of healthcare access. So it will democratize the healthcare access because it has the ability to make it available for marginalized communities. So what I mean by that, like in 2024, maybe there are companies working on AI-driven tools like chatbots and virtual assistant to make these basic medical guidance available in the areas where there's limited healthcare infrastructure. Like it empowers the patient to make the informed healthcare decisions, and it gives very meaningful insights, right? That would be a very significant step in democratization, this access of healthcare for the people who don't have it. On top of that, we have AI regulations for data privacy. That's another major theme I see happening in 2024, where the data privacy and concerns will come up, and people will actually make this focus. Then they are looking at transparency, accountability, patient sovereignty as part of their regulations, and those will be coming forward. Some other areas I see in 2024 is AI becoming as a service, available for as become like a Copilot will become just a part of your regular everyday work, just like Office 365 Copilot now. It's just going to become so seamless and ubiquitous in your workflow. Then you will think, that's just there, right? AI-driven resource allocation, I think, is going to be a very big use case right now. Even resource allocation in the staff management, supply chain, bed management, demand forecasting, especially for for hospitals and for hospice cares and other places, it needs to be more responsive and adaptive. But that's now they have all this data to capitalize on, previous data, and they can use it to make impressive models around this. These might be a little bold of recommendations, but I think we will see a lot of that happening in 2024.
Yeah, well, and what's interesting is we're going to take all these AI copilots for granted really quickly, just like we did that we could read the EHR and that we could find a document with one search, etc. We didn't have to go to medical records and have them pull the paper chart. So it's interesting how we take this stuff for granted so quickly. I would say one minor tweak, a lot of people talk about, the doctor's not going to be replaced, but the doctor that doesn't use AI is going to be replaced by someone who does, right? I would say the same is true for organizations, and maybe even more true for organizations than people, because it's amazing the hoops people will jump through for surgeons to keep them on staff because there's a shortage. But with organizations that don't embrace AI, they're going to be replaced by organizations with AI. So this is a great discussion. I appreciate you both taking time to share your experience and knowledge with us. So thanks so much, everyone, for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thank you.
Thank you, John.